Hello students, today we shall continue with the topic from medical surgical nursing to cardiovascular system. We shall learn about what is angina pectoris. So in the previous session we have learned about sclerosis and we also learned about what is coronary artery disease, or in short also called as CAD. So atherosclerosis, I hope you remember, is what we learned as the deposition of fatty substances within the walls of the arteries. And if this occurs in the coronary arteries, that is the artery supplying the heart muscle, with the buildup of fat and fatty substances forming a plaque, so that results in something called as coronary artery disease. Now, what happens when this develops? When this happens, the lumen of the artery reduces, or rather narrows. And what happens then? The blood supply through that particular artery is reduced. Eventually, what happens, the patient is going to end up in a lot of pain because the heart is actually demanding oxygen and the blood supply, which it is not able to receive because of these blocked arteries. So eventually, the patient is going to be having severe chest pain or chest discomfort, and this is the reason why he would come to the hospital. And if this continues, the narrowed arteries can also end up having a blockage because of excess thrombus formation, or rather a clot formation, and that disrupts the complete circulation to the heart muscle. And eventually, the person is going to end up having a heart attack, or medically called as myocardial infarction. And in today's topic, we will be learning about one of the main signs and symptoms a person or a patient will experience when he is undergoing this kind of particular condition, where there is excess of plaque buildup in the coronary arteries. And the main signs and symptoms that the patient is going to experience is chest pain and shortness of breath. So angina, in simple words, it means a sudden intense pain in the chest. And the picture here you see is the above picture shows you the normal flow of blood through the arteries. And whereas in the second picture here down, you will see that there is buildup of plaque which eventually narrows the lumen, and that actually is causing a hindrance or blockage in the artery, and that does not allow the adequate amount of blood to flow through. The patient is going to end up with this particular condition called as angina pectoris. Okay, and this is what the patient would be experiencing, like he may be holding his chest, and cause the pain can be very intense. It's nothing but also you might start feeling like a tightness in the chest, rather a discomfort or a complete like a pressure on your chest, and the patient is going to be experiencing sweating and shortness of breath, and this but angina or rather chest pain is going to be the main signs and symptom. So maybe a definition for angina pectoris would be insufficient blood flow to the heart muscle from narrowing of coronary artery that may cause chest pain. So in short, you can write it like this. So I hope you understand what is the meaning of gastric pain, because sometimes when you have gastric pain or like gastritis, what happens is it's because of the excess acid formation in the stomach, and all the contents tend to regurgitate, or it comes up, or it comes back in the same direction. So what happens then, even then the patient is going to feel that kind of a burning or a discomfort in the chest. So most of the times what happens is the person, or anyone for that matter, individual, will tend to misinterpret the actual angina for something called as a gastric pain or discomfort, which should not happen. But in most of the cases, yes, if it goes the other way around, it is fine, that having you thinking that you're having a heart attack, but it was only indigestion pain, or maybe due to a gastric problem, it's fine. But we do not want to neglect, and we do not want to end up having getting the earliest remedy of. Now, what are the causes for this particular angina pectoris? Again, it is because of various factors. It could be the main factor is there is no blood and oxygen supply to the particular heart muscle or the myocardium. And this can occur due to various factors. Again, when the person is working out excessively or excess physical activity, okay, and even that can actually, the heart can actually demand for a lot of oxygen and blood supply. Maybe when your arteries are already having this particular disease, then it is actually a big demand for the heart muscle to be supplied with that much amount of blood, which the coronary arteries are not able to do because of this disease in the intima of the coronary arteries. So mostly that, and again, the risk factors can also be, or the causes can also be, the lifestyle habits. It can also be the age, the gender. It can also be due to your habits like excessive smoking, drinking, alcohol, and sometimes what happens, even the weather conditions like extreme cold weathers can also cause problems in them in such patients. Again, it is a type of food. Even the diet plays a very important role. Again, in every disease conditions, we have seen that obesity, that also plays a very important factor. So keeping your body weight under control is very, very important. And it also can occur because of excessive stress. So trying to cope with or manage your stress levels is extremely crucial for any individual, because we do not want to end up having such problems or ending up having a. Now, the classification of angina, or also called as the types of angina, mainly we have three types, which is the stable angina, unstable angina, and variant angina. Again, they are known by different names, but you can actually kind of remember this as stable angina is also called as effort angina. So that is a simple way of putting it, but effort angina means usually it occurs when the person is excessively active, like when you're performing a workout, or when you're in excessive physical activity, when you're tending to do a lot of physical work, and that also can put a lot of pressure on the coronary arteries, and eventually the condition can occur. So that is stable angina. And unstable angina is nothing but it's something that is unpredictable, or it just occurs out of the blue. And again, what happens, it could be the result of some kind of plaque formation, or atherosclerosis, or like with blood clot or without blood clot. Again, what happens most of the times, this can also occur when the person is actually resting. Okay, it does not need symptoms come and go, no longer just with activity. So it does not have to be like the previous one where I told you, when a person is doing a lot of physical activity, the person's heart may demand more of oxygen and blood supply, and maybe the person can end up having a stable angina. But whereas an unstable, it can also occur when the person is at rest. And variant angina, or also called as Prinzmetal angina, it is also related to something called as coronary vasospasm. Okay, coronary vasospasm is nothing but like there is spasm. Means you can see this picture here, variant angina. That what happens is there is like cramping, like everything just squeezes out. The artery walls actually get squeezed in, and eventually what happens, that actually narrows the lumen, and eventually what happens, the blood flow is going to be hindered or obstructed. So also this picture here shows you about the normal lumen. Here the first picture is about a normal coronary artery. The second picture, which is indicating the stable angina, it again, maybe the person has got excessive atherosclerosis or coronary artery disease, and on top of that, again, the person's we never know, maybe he is into habits as in not eating right, maybe he is not he is into habits of maybe drinking, smoking, and alcohol. And with all that, again, what happens, there is already narrowing in the arteries, and with this excessive physical activity, or his occupation may be such where that he has to do a lot of work, or a lot of workload, or a lot of physical activity, and with that, again, what happens, the heart is going to be demanding more. Eventually, the patient may end up having a stable angina. The third one that you see here again is something similar, but again, it is usually associated with a blood clot. Okay, so there is plaque formation. You can see the yellow bit here with unstable angina. There is plaque formation or atherosclerosis, but again, it is usually associated or accompanied by a blood clot as well. Again, so this the patient can end up having a blockage again, and there will not be any adequate blood flow. The heart muscle again is in a big problem, because it is demanding more where where the arteries are not in a position to supply. So that kind of a condition, and again, as I mentioned, so this condition can even occur at rest. It does not have to happen or be where the patient is actually doing a lot of physical activity. And the last one, the variant angina, also known as Prinzmetal angina, is nothing but the coronary spasm. As I told you, the arteries just gets cramped or squeezed, and what happens there? The lumen is narrowed, and this can be due to various reasons. Again, which we'll be learning further. And again, what happens? There is narrowed lumen, inadequate blood flow. Again, the heart muscle is not able to receive adequate amount of blood. So this picture here is actually showing you the size of the lumen. Okay, is how a normal lumen is supposed to be looking like. When there is atherosclerosis, the lumen is almost half. And again, when unstable angina, as we saw, there is going to be atherosclerosis as well as thrombus formation, and eventually there is going to be obstruction in the blood flow. And the variant angina, or also called as the coronary vasospasm, again is also going to be hindering or obstructing the blood flow, and the patient is going to end up having a severe chest pain or thrombosis. Or sorry, severe chest pain, and the patient is going to come into the medical emergency. So this is a little bit of content about when you can write about what actually stable angina is, unstable angina is, and also one of them, and start making your notes as well. So characteristics of stable angina, it usually develops when the heart works harder. So that is exactly what I told you. It can also occur when a person is exercising, okay, or climbing a flight of stairs, doing a lot of exercise, and so that is actually going to put the chest or the heart in a lot of demand mode. So what happens there, maybe the arteries are not in a position to supply, and this kind of pain can usually last for a very, very short time. Perhaps it can just be for 5 minutes or less, okay, but at that time the pain can be very sharp, and it can be very, very it can be very painful, okay. So this is what is called as the and unstable angina. Again, the most important thing is, yes, you know how it is associated with atherosclerosis and blood clot, but again it usually occurs at rest. Again, what happens is it is unexpected, and maybe usually more severe, and it lasts longer than stable angina, because as we discussed, stable angina let's just last for about 5 minutes or less, and unstable angina can last a little longer. So this is what you have to do when you're talking to the patient's family when a patient comes in with a condition like this, because you know that you will not be able to extract all this from the patient because he's in a lot of pain. So you can talk to the patient's family and try to get as much information as possible. So you will try to know when the pain started, what was the patient doing when the pain actually occurred, and how long did the pain last for, where did the pain occur, which part of the body. So all this will be in a position for you to actually judge and come to a diagnosis or conclusion that yes, the person is having a stable angina, or is the patient having a unstable angina. And Prince metal angina, or also called as variant angina, usually happens when you are resting again. It is often severe, and it may be relieved with any kind of anti-anginal medication. So what happens there again, as we know, variant angina is related to spasm. So once you're resting and when you're given the vasodilators, where the artery actually opens up, and maybe you wait for a few minutes, you monitor the patient, you do an ECG, maybe the patient will feel better and the pain is all subsided. So with that, again, it is conclusive that it just comes and goes, and it can happen for no reason, and it can be very severe. Now, what is the pathophysiology of angina pectoris? So that means what actually goes on and during this kind of a condition. So as you know, it can occur due to various reasons. It could be atherosclerosis, or blockage or obstruction in the arterial lumen. It can be due to arterial spasm. It can also be due to the formation of plaque within the arteries, and sometimes what happens, this actually breaks and splits, and there is also formation of thrombus or blood clot. So with all this, what happens, you can say that yes, the artery lumen is narrowed, there is insufficient blood flow through the arteries, and the heart muscle is not in a position to receive adequate amount of blood, which eventually results in a lot of demand for oxygen and blood supply. This results in a condition called as ischemia, which is nothing but, as I told you, when there is inadequate or blood flow, and when there is no oxygen supply to the heart muscle. And eventually what is going to happen, the person is going to end up in hypoxia, and means there's going to be definitely no oxygen supply there to the heart muscle. Again, it is going to be resulting in a reduced oxygen supply. That means the demand is more. The heart muscle is actually demanding the oxygen, but it is not able to get them. Eventually, that is going to result in a condition called as angina or chest pain. And as we mentioned, along with this particular condition, when there is a thrombus or a clot formation, then that results in a condition called as unstable angina. So angina pectoris also due to ischemia of heart muscles. So this is another small, a gist of how you try to say what actually happens in the angina pectoris. So there is spasm, obstruction of coronary arteries, resulting in myocardial ischemia. There is reduced oxygen supply to the myocardium, eventually resulting in chest pain or angina pectoris. In either way, you can write it. Whichever you find it easy, you can write this as your. What are the main clinical manifestations of a patient and experience in this kind of disorder or disease? So the main thing would be pain. Okay, pain in the chest area. As I mentioned to you, it can radiate. It can be for a short duration. It can last for a long duration. Sometimes it can radiate as well. So you need to talk to the patient and make it very clear where exactly is the pain from. Is it just sitting in one area? How much is your pain score? You have to definitely ask that, and you need to ensure and write it down in the patient's note about your pain score out of 10, how much it is and what the patient actually feels like, whether it is a throbbing pain, whether it is a crushing pain, whether it is a squeezing pain, or is it just burning, or is it discomfort, or is it a sharp throbbing pain. The other symptoms will also include fatigue, which is nothing but weakness, dizziness, nausea, anxiety. It can also there can be very much of a sweating or profuse sweating or perspiration is also being observed. Breathing problems, heartburn, as well as indigestion. Okay, so these are all the main clinical manifestations notice when a person is having this particular condition. Now, once the person is having this, what happens? He walks into the emergency department, and the emergency team is going to be having a look at this particular patient. So, immediately, what you would do, you would make the patient comfortable. You would not put him flat on the bed because you know that he's finding it difficult to breathe. So, you would support him with pillows, and the first thing you would do is give him a bed, put him on the bed, and give him oxygen. Okay, that is what the first thing you do. Then in the meantime, you would monitor the patient by hooking him up to the monitor, recording his ECG, saturation, very important, in making a note of his pulse, blood pressure, and at the same time, you will also be trying to do a proper 12 lead ECG from which you will be in a position to come to a conclusion or a diagnosis that what the patient is experiencing. Is it a stable angina? Is it an unstable angina? Or is it just a spasm? Okay, so this is what you would do. And in the meantime, the emergency team will also be trying to put in a cannula and the also yes, when you see the pain, you would assess the pain, you would do a thorough physical examination. You will, in the meantime, another doctor or a nurse will be talking to the patient's family, trying to extract the information about when did the pain start, what was the patient doing at the time, and how did the pain last for. Okay, did he vomit, did he eat something heavy, or all this is kind of information you will be trying to get from the patient's relatives or family, and you will be trying to come to a conclusion about how this condition has to be treated. Along with this, there will also be, you will be doing a set of investigations. You will be setting off bloods because you need to know your cardiac biomarkers, such as your CKMB, your troponin, as well as these are called as your cardiac biomarkers. So this is very important because once your heart muscle is kind of damaged, or it is in a lot of demand of oxygen blood supply, that is when all these proteins and your enzymes are released, and we need to ensure what are the levels of these enzymes that are actually released in the system. So that is very important to make a note of your cardiac biomarkers along with a complete blood profile, which includes your lipid profile as well. You will also do a chest x-ray, and also maybe the patient will go in for a imaging. Okay, CT scan also will be done, and the ultimate source, once you know that you have settled the patient, maybe when you record the pain score of the patient, depending on that, you may also give him some kind of anti-anginal medication. And the very common thing that we would do for a patient in this condition is you would give him a nitroglycerine, and that is something like a sublingual tablet that you put under the tongue. And with that, sometimes when especially in kinds of in a kind of situation where it is coronary vasospasm, the vessel actually dilates, and maybe the pain can settle down. So these are all the ways you would try to treat this condition when a patient actually walks into the emergency department with a chest pain. Yes, once all this is done, you may then send the patient for having an angiography done to the cath lab, and that is where the contrast medium will be injected into the coronary arteries, and the exact reason for this chest pain will be then found, because in that you will be able to detect where the blockage is and how much the arteries are narrowed. Then the decision about how to treat it. So this is what it says by saying management. Again, the main aim is to eliminate the pain, the ischemia. And as I mentioned, the first thing what you do is bed rest, administration of nitrates, checking his blood pressure. So that's very, very important. You need to make sure it is at normal levels. If it is high, then you try to give him some beta blockers in order to manage the blood pressure. Anxiety is very, very common, so psychological assurance and reassurance of the patient and the family is very important. And you will also, in the meantime, you would try to do this as soon as possible, like putting in the cannula, giving him some fluids, again if the blood pressure is very, very low, and also at the same time sending off bloods for investigation, because you need to rule out what is the exact cause of this chest pain. And the aim is you're going to be sending this patient for having an angiography done to the cardiac cath lab. And once the patient is in the cath lab, then the management would be first to do a diagnostic measure, which is nothing but angiography. So angiography, once you do, you will try to know what exactly is going on in the coronary arteries. And this is what over in this picture you will notice there is this heart, and maybe somewhere down there you have a blockage. Okay, so this is an enlarged portion of it. So maybe the blockage is there. You will look into it. It looks like this, where you know that there is atherosclerosis. That means there is plaque formation. And what happens? You will do this angiogram and how to fix it. So the best option is to get a stent in. So this actually is a catheter which is balloon. There is a balloon, and on that is mounted the stent. Okay, when you look at the third picture here, you will see that how the cardiac interventionist will actually do or fix this particular condition, like putting this catheter in and then placing the balloon exactly where it is here supposed to be, and trying to make sure the lumen gets open. So the purple thing that you see here is the balloon, and over that is the stent that is mounted. That it is like that spring-like thing which is actually crimped onto the balloon. So once the balloon inflates, the stent also expands, and later the balloon and the catheter actually comes out, leaving the stent behind. So the mesh-like thing that you see in this picture is actually the stent that is being implanted, and then that remains within the patient, and it's through that the blood flow actually occurs. So that means what happens with this procedure? There was a blockage, yes, that was detected relatively, and it has been fixed by putting a stent in. So this kind of a procedure is done in the cardiac cath lab, and once the patient goes back after this procedure, he will be sent to the ICU or the CCU, and where he's going to be monitored, because we do not want any kind of, especially when there is a thrombus or a clot, we do not want the stent also to get occluded or get blocked again. So he has to be observed maybe for the next 24 to 72 hours in the CCU, and then only he will be shifted to the state on ICU or maybe back to the ward. And if in case there is more than 2 or 3 blockages, and maybe the blockages are also very, very bad, and it is very, very critical, and sometimes you never know, even the coronary arteries of the patient may be very, very small or narrow. So in such cases, a stent may not be able to be put in. So at that time, what we do is the best management is performing, or rather sending the patient to the OT or the surgical OT, and the surgical team is going to be intimated. The surgeons are going to, the coronary surgeons are going to be, the cardiac surgeons are going to be around. They're going to be coming in, having a look at the angiography pictures. The interventionist is going to be showing them and talking them through about what the patient came with, and the angiogram, what it shows. So depending on all that, the team is going to make an excellent decision about, yes, it can be fixed by a coronary artery bypass graft. Now, coronary artery bypass means what? You're actually rerouting the circulation. So that means in this picture here, you know that yes, there is an obstruction here, and the heart muscle is not receiving any sort of blood supply. But again, the stent cannot be put in. So what happens? This is the red thing is the aorta, and you will be removing arteries from your leg area. So those are your long arteries, and you remove that. And what happens is there, you use that, maybe it is the blue thing you see is the vein. Okay, maybe there's different ways of doing it. Like you do a what is that, maybe internal mammary artery, okay, that is which supplies to the chest. Again, you may do a superficial femoral artery, which is also one of the longest artery, that is from your leg. You may be able to use that. Sometimes the doctors will also use the venous bypass as the graft. So what happens there, the veins from the leg is also being used as a bypass. So you attach it from the aorta, and from to where the vessel is actually blocked. okay, and the healthy portion of it. So what happens, that particular, especially when the left ventricle actually pumps out blood, it goes in through the aorta. That blood is actually going to flow in through this bypass and also supply the artery as well. So that is called, I mean, by saying bypassing the circulation. So this is what is done in a coronary artery bypass graft. In short, it's also called as CABG. And even for this, you need permission, you need to have the informed consent from the patient family, because it is not an easy decision to make about sending the patient straight away to surgery. And for this, the cardiac interventionist has to discuss with the family, and with their approval only, the patient will be then shifted to the surgical OT for this particular procedure. Now, coming to the main important aspect, the nursing management. As we discussed, once a patient walks in, the whole idea is to keep the patient comfortable, offer him a bed, put him in a comfortable position, administer oxygen, very, very important. Then slowly make sure that you're going to monitor the vital signs, which is crucial. Again, your pulse rate, your ECG, your blood pressure, your saturation. Very, very important. At the same time, you will do a complete 12-lead ECG to actually come to a diagnosis, or rather conclusion about why the patient has this particular chest pain. You will assess the patient's pain score, and then also make a decision about what has to be administered, maybe like an anti-anginal, and also monitor the vital signs along with the oxygen administration. And from then on, what happens, the whole idea is to reduce or to decrease the pain of the patient, put him in a semi-Fowler's position, observe the vital signs, administer oxygen, do the routine investigations, make sure you're assuring and reassuring the patient's family, which is very important as well at the same time. And also the decision about what has to be done next will be also discussed with the family. And and also the next thing is, the nurse will also be cannulating the patient, making sure that she gets a nice IV cannula inserted along with some fluids if the blood pressure is low or is on the lower level, or even for maintenance, you would put the patient on some fluids. And if the decision is to send the patient to the cath lab, then immediately there should be an informed consent form taken, and it has to be discussed with the patient's family. Signature has to be taken. Then the patient is going to be shifted to the cath lab procedure. Okay. Now, after this, what are the main important diagnoses? So, obviously, you know that in this condition, pain is the most important nursing diagnosis. So, acute pain related to myocardial ischemia. The second one important priority-based nursing diagnosis would be ineffective tissue perfusion, because as you know that the myocardial muscle, or the myocardium is in a lot of demand of oxygen and blood supply, which it is not able to receive. Again, we do not want to injure or kill the myocardial tissue. And so, but what is happening? The tissues are not in a position to receive adequate amount of blood, and so that is what is called by saying ineffective tissue perfusion. Anxiety, which is yes, a very common thing. Activity intolerance, yes, related to fatigue, because the patient is not going to be doing this or moving around as he did because of the decreased cardiac output. Along with this, also would be there would be nutritional deficient nutritional in the nutritional status, or is also very important. Risks are very important to be mentioned. The risk for decreased cardiac output and the complications associated with this particular chest pain also has to be mentioned. And last but not the least would be your deficient knowledge. Again, deficient knowledge, again, the interventions would merely teaching the patient and the family about what are the ways in order to prevent another episode from occurring. And the main idea for this health teaching or counseling is to improvise the patient's health condition, to prevent another episode of angina, and also inculcating into the patient and the family all ways of minimizing the stress, and also to improve the quality of life. And the nurse will also be educating and counseling the patient about his activities in life and how he's going to be moderating it, because we know that the stable angina can occur due to excessive physical activity. So you will be talking to the patient and the family about how he can do all these exercises and physical activity in moderation, and also making sure that how you're going to be exposed to the cold weathers. Even that can also result in this particular condition as spasm and all that. So refraining himself from all this unwanted lifestyle habits of smoking, alcohol, and also trying to cope with the stress levels in case if he's doing a job which actually demands more, and avoiding activities which actually requires a lot of effort. So you do not want to put your heart in a lot of strain and stress, so you avoid such activities, and also encourage good period of rest, which is avoiding situations of emotional stress, again very important, and also obesity. So in case of the patient is on the heavier side, you educate the patient and the family about how to maintain the good body weight. Okay, and make sure he drinks plenty of fluids, and avoid caffeine, which is something about excessive intake of coffee and tea, and anything that promotes or actually triggers this kind of chest pain. Okay, and cool weathers, and go for all this activity, yes, is important, but go for this mild and small walks, which is very important, so that you know that he's feeling fresh and active. And also make sure avoid walking when the weather conditions are not very stable. And with this, we come to the end of this particular topic. We will continue in the next session. So thank you for your time.